Hi, I'm Amy Flory with Core Balance Therapy, and today we're going to talk about taping and why we're going to use different kinds of tape. Now, we just tried to do another live video, so if that showed up on your feed, oh well, hopefully this one's going to last. So we do taping for several different reasons. One is to provide specific support. For example, with plantar fasciitis, we're actually trying to change the shape or decrease the movement of the bottom of the foot. In the case of a shoulder sprain, we might want to limit, how somebody moves their arm. So we can kind of brace the arm or the shoulder, sort of like putting the arm in a sling, but still allowing some extra movement. The second reason is we might want to change movement or change the feel of the movement. And that might be, if someone is having problems with throwing, for example, or going downstairs, then we can put some tape on, have them do that activity again, and hey, if it feels better, great, we'll leave the tape on. Another reason we might use taping is to change swelling or bruising, and we don't really know why that helps. Taping helps that, but it seems to. So to go over the first two reasons, supportive taping, most of us are familiar with a white athletic tape. You can get this over the counter at most department, what kind of store, Jay?
And, drugstores.
There we go.
The Walmarts of the world.
Yeah. So, this works well for something temporary, like, you kind of tweak your ankle a little bit, not a full ankle sprain, but maybe a little tweak. You can put some tape on and help you finish the game or finish your hike or whatever. But it's not going to stay on very long, so not great for longer lasting activity. For that, what we want to use is a heavier duty rigid tape. So this is a tape that does not stretch. It's more sticky than your generic kind of over-the-counter tape, but it also is harder to remove. So if somebody wants to use it regularly, then I'll have people usually use some kind of a barrier on the skin before putting it on, and using some kind of an oil to remove the tape so that you don't remove your skin with it. So that kind of rigid tape application works really well with shoulders that are really painful with certain movements, and we just want to keep from going into that position. Supporting the bottom of the feet with plantar fasciitis, where we really don't want the bottom of the foot to kind of spread out like it would normally, just to relieve it for a while. Or sometimes, when we're trying to limit habitual movements. For example, if someone is always slouching and they're having low back pain, well, we might want to learn how to sit without slouching. But because that's a habit, we can't always correct ourselves. So putting some tape on the back that will not allow slouching can be a good way to learn a new way of doing something. So another tape, or another kind of tape, is a stretchy kind of tape. The Kinesio tape is the first main brand, and this is a tape that when we peel the backing, you can see that it actually stretches. So when we put it on the skin, you can feel it there, but it's not going to limit your movement. And it does seem that when we put this kind of tape on, that it can change pain with a certain movement, or somehow change the movement itself. It's a mystery, really, why this works. But I never go on a backpacking trip or a long hiking trip without some strips of this kind of a tape. It's easy to have with you. You can get it in rolls, perforated strips. You can get it in kind of pre-packaged, fancy sort of configurations that usually need help applying. neck pain, shoulder pain. All of these things you can get online. There are good online resources for videos on how to tape yourself or to have someone tape you. I really like using tape because it's a good tool for patients to have to manage their own pain. So they can do that outside of the clinic, feel better while they have it on, and we can get further with our sessions in PT. So there's taping. I hope that answers some of your questions. I know it brings up some others. There are some questionable studies on, well, studies that raise questions as to whether it's really efficacious, but in my experience it does seem to help in the short term, and it helps us make quicker progress. So thanks for listening, and we'll see you next week.